How's it going, everybody? And in this video, I'm going to be talking about how do I study for anatomy in medical school. I'm not saying I'm the best at it. This is definitely something that I'm struggling with because I'm coming into medical school with I had no anatomy experience prior to this. Like I had dissected cats, but not a human being. And even if you have dissection experience, that's not what anatomy is all about. Anatomy is all about being able to become and so familiar with the three-dimensional structure of bones, muscles, arteries, innervations, veins, tendons, ligaments, and membranes. Like in your hip, you've got something like the obturator membrane, and you've also got, holes, or foramen is what they call it, or fossa. So there's just a ton of different three-dimensional structures that you just have to know it cold. And so it's very daunting for someone like me because I'm not a fan of really memorizing stuff, but this is mostly pure memorization. And then, is it like learning a language? To some degree, yes. There's a lot of new words that you're gonna have to get familiar with, but it's not enough to just know the words. You have to be able to associate these words to things in space. And I know that you still kind of do that with language, but in my opinion, what makes this even different from language, more different from language learning, is that it's all about the relative positions of these things. So like knowing that the deltoid is here, knowing that you've got your axillary nerve coming in from, near your brachial plexus, like just being able to have all these reference points to talk about is what makes it really tough. And so in terms of study strategies that I would recommend, and if I could tell myself from like day one, like this is how you should do it, I think the key thing is to be very systematic, because what's happened to me on the anatomy practicals that I've taken is that like I'll know the muscle or I'll know the nerve, but that's not enough because they want to know the action, they want to know the attachment sites, they want to know, other, like the key, like this nerve for this muscle came from which opening, or like which branch of the brachial plexus. Like these are like 2 or 3 level deep questions. And so just being able to say like, oh, I know that this is pec major and that's deltoid, isn't anywhere near enough that you need to know to pass these exams. And so how do you begin to just make sure you've got something that's so comprehensive and so systematic that you're able to do it? And so for me, it really comes down to Anki, but also trying to draw stuff as much as possible. And I was talking with one of the anatomy professors the other day, and the tips that he was giving me was that like just label diagrams again and again and again and again until it's like beat into your memory, and just keep doing it. Just familiarize yourself like with all the bones in the foot. Just be able to immediately recognize the cuboid, be able to immediately recognize the navicular, know what the all these metatarsals are, know the interosseous muscles between them. Like you just have to keep labeling this stuff so many times. It's like if someone just handed you a random map with no labels on it, you're able to just say, oh, I know this street, that street, this street, this building, like that cross section, this water fountain. Like it's basically like that. And then on the anatomy practicals, it's like you're seeing that three-dimensional city, if we're going to stick to the map analogy, and someone's just going to put a pin in a building and there's nothing else there to tell you like, oh, it's this. You just have to know, like, I see this building here, I know that building, and so it has to be this. Like that's just the way anatomy works. And so for me, really challenging, a lot of time, a lot of struggling. And I will say the muscles and the skeleton are definitely stuff that is challenging. And so like it's many levels deep. How do I study for it? So I'll show you guys what I do. The other thing that I think is really helpful to do on your own, because I know you can always look at someone else's resources and just copy it, but that's not really helpful. So what I do is I first start with making an Excel sheet of basically the muscle, the attachment sites to that muscle, because it's going to basically connect 2 or more things together, and then when it contracts, it pulls those 2 things closer together. That could be a tendon, or it could be a ligament, or another muscle, or a bone. So it's like pulling 2 things together or more. So you have to know what those things are. You also need to know what is that nerve that goes to that muscle, because muscles will have one-to-one nerve mappings. Like you only get one muscle, or you only get one nerve innervating one muscle, because when that nerve tells that muscle to fire, that whole muscle is going to contract. Like you're not going to get 2 nerves that have to say, hey, biceps, contract everything. It's like, no, you just have one nerve going into that, like the musculocutaneous nerve that tells the whole bicep, like, you got to contract right now. So it's a lot of like, that's a really common question you're going to get on a practical, is like, they'll pin the biceps and it's not enough to just know like, oh, that's biceps. Like, you got to know that that bicep, even though it looks like, you know, it connects to your humerus, doesn't. It actually connects to the radial tuberosity. It also connects, you know, up into the shoulder on the, and, you know, it's just like, there's a ton of things. The long head goes up into the glenohumeral joint and helps form that labrum. So like, there's just a ton of other things that like, it's not enough to just sit there and know, like, I know that's the biceps, I know this is the humerus. It's like, it's that's the first level, but there's many more levels on top of that that you need to know. Otherwise, in medical school, the sad and unfortunate thing is you will not pass. Like, they do not care that you are able to recognize the muscle. Like, that's maybe a few questions that they're trying to give you nice ones on, but like, a lot of these questions are just that next level understanding. So I'll turn the camera around and I'll show you guys, like, what do my Anki cards look like, and what does my Excel sheet look like, and what resources do I use with this stuff. And so, like, I think another huge one is complete anatomy. You know, people have their own feelings about it. That's great. I use it because it really lets you kind of zoom in on stuff and touch it and just know exactly what that is. And you can maybe develop some way of quizzing yourself to just be like, looking at a body and then looking at it from a particular angle, like if you're doing a practical exam, and just, you know, see if you actually know if that's really the gluteus maximus or not, and then see if you also know that that has to be innervated by the inferior gluteal nerve. Like, just have questions for yourself like that when you're looking at this, because that's exactly what it's like on a practical exam, where you're not told anything and you're just supposed to be able to figure it out based on that small little 2-minute window of this body you can't touch, and you have to know it. So very stressful for me, at least. But I think it just really comes down to, like, you know, channeling that stress and that energy into making sure that you're developing and creating content to help you memorize this stuff, because it is a ton of stuff. And so, yeah, with that, I'll do a little spin around here. So first thing here, this is the Excel sheet that I have. I'll like make this full screen. I'm sorry if it's not picking everything up the greatest, but muscle, nerve, attachments, actions, and then any other notes I have on it that like are helpful for me is something that I do pretty often. This is what the Anki cards look like. So I get a picture. The picture comes from, one second, this place called KenHub, and if you haven't heard of it, they're pretty great at having like really good pictures. This is complete anatomy. It lets you like just pinch and zoom over stuff. And so like, if you wanted to know what these muscles are, like this is the erector spinae muscles, or the rhomboids, or the, like this muscle right here, just looking at it, you know, like it attaches to that superior angle of the scapula. It's going up into the neck. That has to be a levator scapulae. And so you just kind of keep quizzing yourself like that and make sure you get to that level before like you actually go into a practical. And then this is what the Anki looks like. Definitely a ton of just memorizing stuff. And yeah, so I hope this is helpful. If you guys have any questions, let me know. Love to hear your comments too. And I hope everyone out there is doing well. And I'll talk to you guys next time.